All right, hey guys, what's up? It's Stephen Dunn here with CORE Therapy and Pilates, and I have a very special guest with me today. It's my brother, Dr. James Dunn, who's a urogynecologist out of Northern California area right now. And we did one of these discussions, it's been several months ago, and we talked about pelvic floor health, and we talked about some the programs that Jamie does, Dr. Dunn does for his pelvic floor patients. And we talked a little bit about the difference between what is a urogynecologist and what is the difference between seeing a urogynecologist and a regular OBGYN for the kind of surgeries that he does. And my reference or my discussion was I like to compare it to a dentist and an oral surgeon. You can get your dentist to pull your wisdom teeth, or you can get an oral surgeon to pull your wisdom teeth. Both of them can do the job. It's just one of them does a lot more than the other, and one of them would be more of an expert of the surgical part, and one would be more of an expert of the other things. And so I think that's a real simple way to talk about it. Now, if anyone has any comments, put them below, and we'll be happy to answer any questions. But what I wanted to do is just continue the conversation, because something that is that I find is of importance, or that I find is we're at a place now where it's okay for women to basically have urinary incontinence. There seems to be the push, the message from the watching TV, it's all about medications, or it's all about diapers, wear diapers, adult diapers. And I think there's a different way of approaching things other than just spending money on adult diapers. And I can't remember the figure, but the amount of money spent on adult diapers, billions versus actually trying to get it taken care of, way less on a yearly basis. Yes. So with that said, thanks for being here, Dr. Dunn.
Yes, wonderful Thanksgiving.
And yeah, we got to spend some time for Thanksgiving, and he's leaving today, so I took advantage. I was like, hey, give me 10 minutes and let's go through some stuff. So my first question to you is if a woman is having, when is the right time for a woman to come see you?
Yeah, probably. I mean, I get consults all the time. Ignore that. With more advanced problems, moderate and severe problems in older women. But I think the best time is 30s and 40s after childbirth. Definitely start on some kind, pelvic floor therapy on their own. If the symptoms progress or don't respond to simple Kegel exercises and pelvic floor training at home. Weighted cones, vaginal weights, things like that you can do on your own, then yeah, physical therapy, more aggressive treatments. But I would start right after childbearing.
So basically, is it normal to be having any urinary incontinence?
It's not normal, it's just
it's common.
It's common. So it's a common thing. It's not like I get that question a lot. It's just a common consequence of childbirth and pregnancy. Is the number one risk, so especially vaginal deliveries. You get some protection from cesarean sections, but pregnancy itself is the number one risk factor.
And if someone comes in with urinary incontinence, the treatment plan doesn't start with surgical intervention. It starts with other stuff first, correct?
Very rarely does someone come in and already made up their mind. They're like, I want surgery because of whatever they've heard or read, or my friend had surgery and I want that surgery. Most women come in and say, yes, I prefer conservative, non-surgical medications if there are therapy. So, yeah.
And then if someone goes through the conservative treatment, they do the Kegels, pelvic floor strengthening, they do the possible probes and E-stim training.
Correct.
What kind of what's the numbers of people, the percentage of people that go through that program and then end up needing to have surgery?
So we'll go to the positive, about 70 to 80% improve or significantly get better where they don't need surgical therapy or other therapy. So that leaves about probably 15 or 20% of women who do need surgery or fail conservative options.
And let me ask you this: you and I have had this conversation. If you watch the TV, you see all these lawyers advertising if you've had mesh surgeries to call them for this and that. So I think there's been some maybe misinformation or some bad information out on these mesh products, where I have people ask me questions about the mesh because they've seen the lawyers advertising.
Right.
And that's something that I don't really understand or know, but you mentioned to me that if you were concerned about the mesh, that no surgeries would be happening. It's kind of what we talked about. It's been several months ago,
Yeah.
but with the mesh and the kind of fear factor out there of, if you get this incontinence surgery and they're using this certain mesh, that there's going to be a long-term problem or a lawsuit after. Tell me a little bit about that.
Well, the mesh surgeries are definitely there. They have mesh surgeries and they have non-mesh surgeries that I offer, and you basically, we have that long discussion as far as the consent process. Do you want this with these risks and benefits in this surgery? The main concern with the lawyer ads is based on the pelvic surgery with mesh. It does have a higher complication. I haven't been doing that mesh surgery. I still do the sling surgeries, but with a longer discussion and say, yes, every surgery has risk. The mesh surgery has some specific risks only related to the mesh, and so you just have to say the risks are 90% plus for success and a couple % chance of those things you see on TV, and then you go from there.
Got it.
After that process.
Got it. Well, these are just some things that questions that I get, questions that I don't always know the answers to, and so while you were here, I wanted to go through and ask a few questions. It doesn't look, we've got a few people that have jumped in. Hey Jared, what's happening, buddy? We don't have any questions that have popped up. So let me finish with this one. If someone goes through the procedure, or they go through the surgical procedure for a sling, for example, what kind of recovery is after that, and how long before they're able to do normal exercise, and how long are they, when should they start doing Kegels?
Probably right after surgery, start your Kegel therapy, because that doesn't disrupt or injure, complicate the recovery. For after the surgeries, I typically do a combination of pelvic surgery, like bladder lifts and sling surgery. So I ask those ladies to go slow for 6 weeks. Not do nothing. I want them to get their cardiovascular fitness so they can walk and treadmill and swim and do light. I just ask them not to lift anything heavy.
And low impact.
Low impact. We made the number up 20 pounds. Don't lift more than 20 pounds, but we don't have a study that says yes or no. And so I tell them, be moving, but just be mindful of how much pressure you put on the pelvic floor.
Got it. Because that's a question that I get, and usually by the time they're coming to see me after surgeries, it's been more than those 6 weeks, just based on the whole process. But that's a question that I've gotten, and 6 weeks is kind of a safe zone for many things in medicine. Bones, fractures heal in 6 weeks. A lot of stuff happened in about 6 weeks, so that's typically a safe answer, but I just wanted to get your clarification of that. All right, guys, so with that said, we are done for the day. Hey, Andy, what's happening, buddy? So if you have any questions, if you're watching it later on the replay, put some questions down below, and we'll be happy to answer them. But I got Jamie in town for the rest of the day, and I wanted to take advantage of sharing some information that can be useful to our clientele. So with that said, thanks for your time. Thanks for your time, Jamie, and thanks for your time for watching. And we'll see y'all on the flip side, guys. Now he's got a Pilates class.
Pilates.
Peace, guys.